The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, everyone. Welcome to Financial Rebellion. It's Thursday, the 16th of April, 2026. We are live here with Twyla Brace and Carolyn Betts. What are we going to be talking about today, Carolyn?
We're talking about AI scribes and the AI in the exam room.
Yeah. All right. Well, let's do the news first, and then we will get on to what even an AI scribe even is. So, starting up with our first headline, Maine lawmakers pass nation's first statewide ban on large data centers. So, Carolyn, I was just telling you this before we were live. Someone actually asked me the other day, they don't even understand what a data center is. Even though we've been talking about it, they said it's so confusing to them. So,
Right. A data center is something that would be built by a company like Amazon or Meta that has AI systems, and it uses an enormous amount of water and an enormous amount of electricity, which would be drawn from the local area and probably adversely affect the your billing for your water and your electricity, unless there's some sort of local something in the agreement that allows them to build it. Presumably, there in some cases there would need to be zoning changes or whatever. They have to be approved by the locality. A lot of times they're located in rural areas, which means that they're clearing out farmland, and but the reports are that they're very loud, and they're who knows what kind of EMF or whatever they're putting off. But it's basically a storage facility for electronic equipment that's involved in building AI. And from the air, you'll look down when you're in a plane and see what looks like warehouses, and a lot of those are data centers. Ohio, where I live, has the fourth largest number of data centers in the country, and they're talking about building another $500 billion one. I mean, these are huge, and they're going up all over the country, and the local people often don't know what's going on when the preliminary plans are being made. So it's really worth, if you want to be active, it's really worth inquiring among the local governance mechanisms, whether it's a city council or a township group or whatever the local governing body is, what's going on and whether there are any in the works. Because what tends to happen is that the local people only find out about it after all the plans have been made, and they're told, well, it's too late to do anything about it now. But there are a number of groups, and if you do searches on the internet, you'll find, I want to say it's Middletown in Ohio. A whole bunch of people showed up at the city council or whatever meeting, and adamantly opposed signing the documents that would approve it, and they at least tabled it for the time being. But there are a lot of stories in the news, but it's something that definitely disrupts local life, and presumably affects agriculture and wildlife in the area. Not to mention your billings and what happens with the water. Presumably, the water is cooling. When you have a big facility with electronic equipment, you need to cool it. So that's what the water is for, and it uses enormous amount, like country level, small countries use less AI, less electricity than some of these data centers do. So it's definitely something that's going in all over the country, and local people are only now starting to understand what's involved. Yeah, the gigawattage is just enormous that they use.
Yeah, I was just looking to see because I just read something last night. So I was just looking through to see if I could find the statistic about, like you said, countries worth. And that's exactly right. There was some statistic about 4 times the something or other. It was like 4 times what this enormous city would be one data center. And but like you say, it can also be countries worth. So it really just depends on how big the data center is. And so, and then what happens when it all goes bust, right? It's an enormous drain on the system, but then it's also huge things can happen if things go awry with it.
Well, and if things go awry, who has first dibs on what's available?
Right.
Is it the data centers? Is it Amazon? Or is it, our homes?
And I think it's so important that you mentioned the noise. If you think about what's happening around the country when it comes to, okay, I think of it, the wind,
The turbines, yeah.
the turbines, right? The wind turbines, right? People who aren't even that close to them can hear the noise, and it's a constant noise, a constant thrum, right, of the throb of the thing going around. And here, imagine just being next to a jet engine, for example. I can imagine that it's like being next to a jet engine 24/7. That's
Well,
what
and
I'm thinking.
if you moved out into an rural area wanting peace and quiet, you're not going to get it if there's a data center, close by.
Right. So yeah, I think it's a big deal. And some of the articles that I was reading about AI just showed how everybody's like banking on AI, and they're thinking that it might actually be a bubble. It might not produce what they think it's going to do. It might be that people will walk away from it. And as I was telling you both before the show, I was talking to a PhD in AI, and it's his job to review these different documents and look to see whether or not they've been created by AI. And it's funny because he'll say, I know when they've changed from Grok to Claude to Chat GPT. I can see when they've made the change because I know how the AI versions work. And he said, never create with AI. Never create with AI because it can't be trusted. You can use it for a reference, like a search engine, but even then, you have to go look at what it says and see whether it's really true. Because I've seen some things in AI and I go, I don't think so. But I look at their sources and then it's not even there. It's not even there.
So Twyla, when you say never create, what do you mean? Because people I can see, we just advertised for some positions here at CHD, and most of them are AI generated. I mean, are you saying don't create your resume, which I really, by the way, if you're going to apply to children's self-defense, please don't use AI because it's not going to do well for you.
Yeah. Well, I would say there are any number of reasons. I think he said never create with AI because he knows all the problems with AI, right? He knows how it hallucinates. And there was a great article, it might have been in the Wall Street Journal, it might have been in the Epic Times, I'm not exactly sure, where it talked about the problem with AI is if you do not feed it regularly, it needs tons and tons of data. And if it doesn't have new data coming in, it will take from old data. And then it will start to piece things together as though they were true. And that's called hallucinating. And that is a problem with AI. It is a known problem. It is a chronic problem. It is a not going away problem. And so if you're counting on AI to give you the truth and it just doesn't feel like it has enough data, it will pull it from anywhere and string it together as though it was. And I remember in, I think it was MedPage, probably the editor of MedPage, who's also a physician, he wrote an article, I think it was MedPage, but what I remember is the article title, My Chat GPT Just Lied to Me. And he said, so he gave it a medical problem, right? And he's reading along and he's like, yep, that's good. Wait a minute. What? And so it's like, remember, it's a machine. It's just a computer. It doesn't think, it prognosticates sort of, right? It predicts, it puts things together how the programmers made it to put things together. And so it just started putting things together that totally weren't true. But he knew because he was an experienced physician, he knew. But another physician, Dr. Robert Walkner, who said he's been in practice for 40 years, and he was talking about AI and I recently quoted him, and I'm paraphrasing now, but he basically said something like this: I'm not worried about myself because I've been working for 40 years. And yes, I'm a little concerned about de-skilling, like his skills will be diminished somewhat. But he said, but for the most part, what I'm really worried about is the unskilling of doctors.
Yeah.
Like they won't even get the skills, and
Right.
and then they won't even know. They won't know what they read. They won't know if it's true. They won't know if it works. They just won't know. And what kind of a medical system will we have when we have doctors who have no skills?
Well, and there are also protocols that are developed by AI.
Yes,
If you have AI developing protocols, the particularly young doctors don't know where those came from, and they get instituted by an institution like a hospital or whatever, and they're just blindly applied. And if you don't have people who know that those are damaging and say, no, remember remdesivir and the ventilators.
exactly.
I mean, those were
Exactly.
part of protocols, and they were applied to people who were greatly damaged and, killed. So,
I remember Dr. Molly James, her story in Missouri. So she was a ICU, CCU kind of physician. So she was taking care of people in the ICU that had COVID, and she was watching them die. And somehow she got, wind of ivermectin. She thought, well, no harm to try it. All these people are dying, right? So she starts trying it and it starts working. And then the hospital figures out that she's doing this and it's not within the protocols. And so they tell her you have to stop. And she didn't stop. So they pulled the ivermectin out of the hospital so it could not even be ordered. And I think, that's the thing about the electronic data systems today. It's not about convenience. It's not about the patient. It's about control. And so the controllers, the administration, the government, whomever, can see every last little thing that every doctor does and every last little thing in your record, right? And so it can be used for control. And they can impose the AI produced protocols, right? And then they can see when you follow them and when you don't follow them. And if you're not skilled or you haven't been taught critical thinking, or the only thing you've been taught in medical school is to follow a protocol, or you'll be dinged, you'll be ousted, you'll be paid less, more money will be withheld, whatever, black marks on your record. Your entire team will be saying, you're making our clinic look bad. Our clinic's looking bad because you haven't done X or you haven't done Y, and we're not getting as much money because of you, and so you've got to go, right? So this is the whole thing about protocols. Even if they're generated by AI, the doctor's looking at his income and going, should I even look to see if there's something better? What if I do know that there's something better? Maybe I should not just talk about it.
Yeah, good
Yep.
point. All right, I
Do
think
we
we
have
have
any
another
other
article here. Yeah, I think we do. There we go. CMS aims to modernize patient data access in US with QR codes and biometrics. Great. Talk about that, Twyla. What's that about?
The technocrats are well embedded in the administration and are moving to do everything by digital and biometrics. And so CMS is the Centers for Medicare and Medicaid Services, and they want to move to a future where all of us will use our face or our fingerprint or our thumbprint in order to access our data, to look at where we are in the Medicare system, have the bills been paid, how many is left, do we have to pay it, whatever, or even into the Social Security system. The whole idea here is to require you to give your face or to give your fingerprint into a system. And remember, you're not a criminal. The only people that should be being fingerprinted are the criminals, and you're not. But this is the gathering of the biometrics, and as you gather biometrics, the government gathers power. As they gather biometrics of the people, they're just helping to build a national facial recognition system through these various systems.
and if you think that because it's centered for Medicare and Medicaid services, that it doesn't apply to you, I'm telling you, they have a monopoly in the whole healthcare system, and whatever
You're right.
CMS says applies to everyone, including the people who have private insurance. I had a client who was out of the military and therefore had TRICARE and
TRICARE.
some super duper policy that most people don't know about because she was married had been married to a high-level officer, and I tried to tell the social workers that she was covered, and they were just like, no, Medicare, Medicaid doesn't cover that. And I said, she's not old enough for Medicare, and she makes too much money for Medicaid. She's in the TRICARE system. They would not listen. They apply the CMS protocols, standards, rules, all of that applies to all healthcare. All
Yeah, I think
healthcare that gets money, that services, which is why going to a doctor that does not take insurance at all means you're out of that system. But if the doctor takes even private healthcare or Medicare, Medicaid, they're in that.
yes, that's correct. So often I do healthcare policy, right? So often in this sphere, they will say, as goes Medicare, so goes all of healthcare. And so because, a doctor, a hospital, whomever, they do not want to have, like a two-track system. Right, that's very difficult to try and keep, these people or that people, and we'll treat them all differently. Nope, they're going to treat them the way that they have to. And their biggest client is Medicare. See, this is what patients don't understand either, because patients don't often pay the bills. They're not the client. It is Medicare, it is the health plan, it might even be the employer who's the client. It's not the patient. And so because Medicare has so many rules and regulations, Obamacare all by itself, just so you, in case nobody knows this, but I stood once next to the stack of Obamacare regulations in 2012. And it was higher than me standing with my hand as far as I could reach. That was Obamacare. And it had only been in for, well, it wasn't even completely in. I think that was 2012, whatever. And so if you look at Medicare, Medicare's been here since 1966 is the first Medicare patient. First patient became Medicare, and that was actually Harry S. Truman, former president. Harry S. Truman, who wanted a national healthcare system. So he got the first Medicare card on July 1st, 1966, I think. So just look at all of these years of Medicare and think about the mind-boggling amount of regulations that are there in controlling the entire healthcare industry. And they only want a one-track system of how to work. And so as goes Medicare, as goes the entire healthcare system. The payments might be different, but all the rest is the same.
Twyla, isn't it true? I am under the impression that the VA system isn't governed by CMS, and there are some things that you can get from the VA system that are superior because they're not governed by CMS. Is that true?
Well, I'll say that I think that might indeed be true because it's totally under it's the VA system is a VA system. It's another department, right? Just like CMS is a department, the VA is a department. So you're right that is true. And when they go to VA hospitals, there is indeed, they can have their own processes and procedures and things that you're allowed under the VA system. But as you might recall, I would be hard pressed to use the word superior. It might be some things that are superior because you could get them that you couldn't get on the outside, maybe. But you might recall that people were on a waiting list, and this was in Arizona in particular. They were on a waiting list and they just scrapped the waiting list, and people died in the VA system because there wasn't enough room for them to get in the VA system.
Right. If you're an officer and you have a choice, it might be worth looking into whether it's better to go into a VA or a non-VA.
Yeah. But in my the Medicare how-to guide from our organization, it talks about TRICARE, for example, because there's some really important information about TRICARE because Medicare Advantage plans will come after people who are on TRICARE and will convince them it's a far better deal. And so I have word for word transcribed from somebody who has said, no, never do that. And then you won't be able to get back into what was so much better than Medicare Advantage, what you had with TRICARE.
Okay.
When you're over 65. So
useful information.
Do we go for a term of the day?
Yes, the term of the day is AI Scribe, and we're going to be talking about AI Scribes. An AI Scribe is a software system that listens to a spoken conversation, typically between a clinician, like a doctor, and a patient. and automatically generates a structured written record of the encounter, usually in the form of a clinical note formatted for entry into an electronic health record. The core technology combines automatic speech recognition, which converts the spoken audio to text, with large language models, which interpret the text and organize it into clinically meaningful documentation. Chief complaint, history of the patient illness, assessment plan, and so on. The most recent generation of these tools is described as ambient because they work passively in the background without requiring the clinician to dictate or interact with the system directly. The clinician simply sees the patient normally, and the note is generated afterward for review and sign off. So the clinician, in most cases a doctor, has to sign off on the electronic health record, but that also means they have to take the time and look carefully at what was transcribed and presumably take out anything that's not relevant. I mean, imagine an AI scribe is listening to you in an emergency room and you're there for 5 hours. The clinician is supposed to be turning it on and off, but what if they forget and it all goes into a system that's a third-party system? So you know much more about this than I do, Twyla, but that's my version of what an AI scribe is.
Well, go ahead, Polly.
I just think everyone wants to know what could possibly go wrong.
Well, I think there are so many things to say about AI scribes. Is this the time that we should talk about them?
Yeah.
Because I can say a lot of things about AI
Yeah,
scribes.
go ahead.
Okay. So ambient listening. So first of all, I just want to alert all of your viewers about ambient listening. And I want you to look for it at the exam room. I want you to look for it at the hospital. Wherever you are, look for the words ambient listening. And you can even ask, are there any ambient listening devices that I should be aware of in this room or in this hospital, right? So ask the question. And ambient listening is, as Carolyn says, it's just a device and it's out there picking everything up. And then it's going to transcribe it into a record. And I do mean everything up. So every little word that you say could end up into that record. Every person that you mention, every swear word that you might say because you're frustrated, everything could be put into your medical record that happens there. So what we're really talking about here is a third party in the exam room. And that has never been allowed without your consent, ever.
And so tell us about the consent.
Right. So the consent or the lack thereof. So I think we should talk about the various ways of consent. So I have had my own experiences with this and other people have as well. So I'll just share some of them. So I have had pictures sent to me from exam rooms where there's a sign in the exam room that says ambient listening. By staying in this room, you have agreed to have the entire conversation recorded. Essentially, if you don't want to, leave, right? Now here we're talking about a patient, a vulnerable individual, because every patient is a vulnerable individual. And you're telling them either accept the fact that we're going to record every word that you say in this room or leave is essentially what's being said. Now, I have seen consent forms where it's a consent form solely for ambient listening. So it says ambient listening, and then it says, this is what we will do. If you don't want us to do this, let us know. Otherwise, sign on the dotted line below. And then, so that's one. The other is it could be in what we call a coercive or consolidated consent form. It's consent to be treated, consent to be billed, consent for this, consent for that, consent to be tested if they think you might have been exposed to HIV while you were there in the exam room, whatever, right? But then they could have a line about that, consent to ambient listening, but there's only one signature line at the bottom of this form. Now, again, most people coming in are vulnerable. They got a reason that they're there. There's something that they need that they cannot get, and they don't want to anger the staff. So they want to be compliant because they need to get this. And they look at all this and go, I don't really have a choice here. But I'm here to empower all of your viewers to take a choice and to believe that they are powered powerful enough and empowered to make a choice here. Here are some other ways that this happens. It happened to me recently with a physician who walks in with his phone in his hand, and he says, "I'll be recording this visit if you don't mind, blah, blah." And I said, "Well, I do mind, actually." And he said, "But I won't get as much of, it won't be as complete." Doesn't matter to me. Actually, I just looked at him. I didn't say anything. They put the phone away, turned it off, put it away. And then somebody else, this AI consultant, PhD that I was talking with you about and maybe mentioned earlier. So he said he was in a room with a clinician. He had the entire appointment, and the clinician looked up at the end of it and said, "Oh, by the way, this was all recorded." He said, "You didn't ask me." And he said, "Yeah, I was supposed to, but I forgot." And then this AI PhD said, "Well, actually, I'd be more worried for you because you've just increased your liability in ways that you don't even realize by every word, taking every word." And I was just looking at something from the American Bar Association, which talked about how much it has increased not only privacy risks, but also cybersecurity risks. And so by bringing in a system that could be sending your data to India to be transcribed and sent back, right? There's so many ways, as Carolyn said, there's so many ways that this could go wrong. But I think we should think even more broadly about the scribe situation. Like, why is there a third person in the exam room? We've sort of all gotten used to this third person walking in, with the computer, the doctor's there, you're talking to the doctor, and there's this silent listener typing away all the words that this silent listener can figure out, but she or he is standing there with the computer, right? Why is that? Well, that is because they have imposed the electronic health record system on the clinics and the hospitals, and they're using them for billing and for data entry and data reporting. This is not about taking care of the patient. And in order to make this happen so the doctors can get paid, they have to employ these other people so they can hopefully listen to the patient, although they're not listening as long anymore. And they can have somebody else who writes because they got to just go so fast, right? And so they've really turned the entire confidentiality of the exam room on its head and made us all believe that we have to have scribes. And it's really because of what the government did. There shouldn't be a scribe in the exam room. There shouldn't be any kind of scribe, AI or other person in the exam room. It should be a very confidential place where you can speak frankly, you can feel safe, you can have trust, and you can know that you can say things that will never, ever, ever get into anybody else's ears.
Twyla,
and
can I
go
just
ahead.
say, so for the people out there that say, well, look, I really don't care if it makes them do a better job, blah, the usual things people say. But here's my concern. Can you talk about some of the things that could go wrong? For example, imagine if you had your child in the emergency or wherever you were in the room, and the doctor leaves and you and your husband have a private conversation about something, and that's being transcribed. I mean, it could end up that Child Protective Services could come just because you've had a conversation. I'm just thinking that's the kind of thing that would happen to me and my husband. We're in that, it's like, what on earth? You know what I'm saying? I
Right.
don't ever go to hospital in this day and age. But just I want people to understand there are other issues that could go very badly wrong.
Yes.
Well, and let's say you're in a traffic accident and you are careful about what you say about what happened. Then you have a private conversation, and that isn't, maybe it isn't lying or anything, but maybe it sounds a little inconsistent. You're not careful because you're talking to your husband or whatever,
Yeah.
and it's different. It's probably discoverable
Probably.
in a court case, and it's a third party involved. I mean, the law has not caught up with third party presence in you have attorney-client privilege, you have doctor-client privilege, but then the data is going off to, how many other third parties and what kind of protection do you have? yes, Polly, it's a real thing about child protective services because there are doctors you probably know this, doctors who specialize in child protective service type stuff, and they're looking for reasons to bring in the child protective services in completely innocent situations, and it's you don't want to lose your kid. You be very careful about what you say.
So
Well,
carry on,
go
Twyla.
ahead.
No, I was just going to say, so Twyla, tell us what else can go wrong and what do we do?
Yeah, so just even think about healthcare or the exam room and how vulnerable you are and what you might be willing to say to try to get the care that you need and what you hope you can say safely. Because if you have to not tell the whole story, then maybe you won't get the right care. And you're aware now that these listening devices are here. And by the way, there's a listening devices where they have them like in the room, and then there's a listening devices like they bring them in the room, like the guy who brought his phone in, or the woman physician who brought her computer in and said, "I'll turn this on for," no, you won't, right? And so if you just think about all the possible discussions that you could have when the doctor or the nurse or whomever is in there and when they're not in there, the different things in your family that you could talk about, the different situations that might come up, some little casual comment about how you were out for the weekend and you think you were drunk but nothing happened, and maybe something you say about your friend or something you say about your family, and now that becomes part of the record. The other thing though is, look what happens when you do voice to text, right? You got to look that over carefully. There's so many interesting words that pop out because the AI doesn't hear you correctly, right? And so then there's all of this other stuff that gets interjected in there. And all you really want the doctor to keep a record of is what's necessary to know what your problem is, to know how what treatment was chosen, and what your objective and subject. So how do you look? What do you say? What kind of treatment am I going to give? And any impressions from the doctor that are related to this. But with AI in the exam room, anything and everything is game. Anything and everything that you say, whether it's to the police, like you say, it could be discoverable, something about the night before, and they find out that you were at the party. Oh, well, and then he went to the emergency room afterwards, and so let's go get that record and see if he knows anything about what happened at the party last night. I don't think we can even think of all the different things. But the other thing is that doctors and clinics are trying to force the parents out of the exam room with their teenage children. And they will actually tell parents, you have to leave unless your son or your daughter gives you permission to stay. And so now what we have is we have obstinate children who will say, no, don't want them here, right? And then we have parents who just bow to this instead of being like one guy I know who is a 6'4" black guy with his 16-year-old son who said, yeah, I'm not leaving. You got to leave. Nope, not happening. And the staff said, well, to the son, well, if you give your father permission, we can leave him. We can let him stay here. And he looked at them and said, I don't give my father permission for anything. It was like, I'm not the decider here, right? And so that father stayed in the room. But imagine the things a child could be asked that then become part of a record and recorded by AI for the parents who leave their child vulnerable and alone in that exam room for that inquisition.
Well, and Twyla, there are exam rooms where you're separated from the next room by a curtain.
Yeah,
And
that's nice too.
the devices can be picking up things that people are saying in the next cubicle or whatever it is. And
Right.
so the other thing is, what about people's accents and just, the way they speak? The AI could be transcribing it incorrectly. And I mean, there could be the wrong medications. There are all sorts of things that could happen. And the doctor has to be really careful. The doctors are under a lot of pressure to spend less time with patients, and they've got to sign off on that medical record. How carefully are they looking at it to make sure there's not incorrect information in there?
Well, there was on LinkedIn, there was a physician who talked about, they looked at their entire clinic to see what kind of time doctors were spending with patients versus paperwork. And if I am correct, it was 11 minutes with the patient and 37 minutes with the paperwork. And so what you can see is that the focus of the clinicians today is on the paperwork. Now, if they've got lots and lots of them to go through and they don't get through them for the day, they end up doing what's called pajama time. That means that they go home, they have dinner with their family, and then they spend the next 2 to 3 hours doing all the paperwork, dotting all the I's, crossing all the T's to send in the reports in hopes that they will be paid fully for their services. And so it probably does depend on how tired or exhausted a physician is when they look over that to see whether or not it's accurate. And then do they remember, right? Do they remember? And are they going to count on the AI to be their memory, right? And then say, oh, I didn't realize she said that. Must be she said that. And so, or even, I don't know that I ordered that. Let's see, why would I have, or maybe, I don't think I ordered that. But what if they miss that? And I don't know about your viewers, what kind of mistakes that they have had, but I have had more mistakes since the electronic medical record, like, instead of getting 10 pills for infection, getting 1. Really? So they just pulled on the menu, they just pulled down to the wrong and they let go, and they just didn't notice that they had clicked on the wrong thing. So I think there's just so much that can happen when the brain is not fully engaged and they're just depending on a computer. I don't think that they want to, but this is the system that the government has put in place at the moment. And this is why a lot of physicians are trying to figure out how to leave. And this is why patients are trying to figure out how to leave. Because, one of the things that we say is the mission of medicine has been taken over by the business of healthcare. And anybody who is in the exam room today who knew what it was like before sees how real that is.
So what are you suggesting that we do about it? We say no when we look around for the ambient listening thing.
Yeah, well, it's probably, you may or may not be able to look around for it. And like if that doctor had walked in with his phone as he did and not told me that he was recording, I would have assumed he was just walking in with his phone, right? Everybody's walking around with their phones. So I think the thing to do is, 1, look for the consent forms for ambient listening, but then ask the question. Ask the question of the staff. You can call them up in advance and say, are there ambient listening devices I need to make sure are shut off at your clinic? I mean, the more that people make us think about it, the more it will be that they realize that they can't do this to us. They can't have listeners in the exam room with us, gathering all sorts of information and putting us in harm's way in ways we can't even imagine. So you need to ask the question and you need to look at the consent forms and then you need to stick with it, right? So let's just say you're at Clinic X, and at Clinic X, they have an ambient listening device and they have it either embedded in the consolidated consent form, or they have it as a separate consent form, or they have it hanging in the room, right? But there is a presumption from the clinicians that that you just said yes. Because it's, you just sign, most people just sign these forms. They aren't actually reading them. They're just, they're just signing them, right? So you said no, but they don't really realize you said no, and they don't look to see that you said no, and the people out on the desk never entered it in the computer yet that you said no by the time you get in the exam room. So you really have to ask the question, is there an ambient listening device here? And if so, I want it shut off.
And Twyla, you've written a book about this, right?
Well, not so. I've written a book about privacy in the exam room. So it's called Big Brother in the Exam Room, The Dangerous Truth about Electronic Health Records. And it was in 2018, but the book is still selling on my 4th printing. And at that time, there were mostly medical scribes, and the idea of AI scribes was just coming. And they were thinking about essentially hanging listening devices in each room. That's what was happening at that time when I wrote the book. So I wrote about that, and I wrote about medical scribes and how you can even tell the people who are scribes. You can tell the doctor, I don't want a scribe in here. And then he or she will be forced to write their own notes and then go do something with them, because you have a right to not have a third person in the exam room. But if you're just like, going for orthopedics or, dermatology or anything you really don't even care about, and you don't mind having a third party in there, okay. But it's amazing what kind of conversation you might end up talking about that you didn't expect.
Yeah, be particularly careful about mentioning depression. They're always asking, are you feeling bad today? Are you depressed today? Be really careful about that. And I'm thinking it might be a good idea to take somebody with you. Like, let's say you have a husband who's really pushy and very assertive. That might be a good person to be an observer of what's going on and also help you say no.
Yeah,
Because
because you are vulnerable.
You're a people pleaser and you don't want to create a scene or whatever. But if you have somebody with you who are looking out for this sort of thing and have read some of these articles and know what to look for, that might be really helpful.
Yeah. The thing that's really sad, speaking as a nurse, is that it used to be that the exam room was a sanctuary of sorts. It even used to be a sanctuary for criminals, because there was this recognition that the doctor could do what the doctor needed to do and hold the confidences of the patient. And only if, like, abuse, like somebody was being a child, right, was being abused. But today it is not a sanctuary in any way, shape, or form, and you have to be battle ready to go into the exam room, and it's not good. It's not how it should be. It should be a safe place for you to say everything that you have to say to get the care that you need, and you should be able to trust that you will be held safe in this environment. Because this is a mission. Medicine has always been a mission, and since it turned into a business, you're no longer safe.
I remember the days back in the day when my children were little that everything was written, paper medical records in England. And when they changed them over to electronic, we tried to get Billy, the son that was injured by the vaccine, we tried to get him his medical records, and they had changed. And so my point here, and I'm not the only person, they had left out all the antibiotics he got and all the other stuff that it was just not there anymore. Whereas when they were written down, it would have to be crossed out. So my point is, I think there's a bigger margin now for fraudulent situations to go on.
That is so true, and people don't think about that. And thank you, Polly, for even bringing that up, because that is several things happen. One, there's things in your electronic health record that are no longer true, that are looked at as though they were true, because nobody ever crossed them out or said she's not taking that medication anymore. So they think that you're on 15 medications, and they're like, oh, you're not on that one, oh, you're not on that one, oh, right? So it's just like things stay in there even though they're not true. But the other thing is, we could not change anything in the medical record. It had to be done in pen. And if we made an error, it had to be crossed out, timed, initialed, right? And then we would write what was actually true after it. And electronically, things can be changed in ways that they couldn't have been changed then, and things can just disappear.
And they can actually be hacked. I had a client whose ex-husband was high-level military intelligence. She had lupus and therefore had liver problems as a result of lupus. He got into her electronic records and put in that she was an alcoholic and that was the result. That's what caused the liver damage. And I saw this and I said to her, do you drink? And she said, no, not at all. And that was in her electronic health record, which most people don't even look at. And so it is possible for people to hack in. And I assume that it could be possible. Let's say that there's malpractice within the hospital, and they could be liable for a lot of money because you're injured. Could they not go in and alter the electronic health record?
So I think that's true that they can, but I do think that you could and might have to hire a forensic expert to go in and figure out where were things changed. I do believe that there is an audit trail, but you do have to hire what's necessary. You have to think, well, maybe it was changed. I don't know if it was changed because I can't see that it was changed. In a paper record, you know something was changed. You know what it looked like. You know what it said, because all it is just one little line through those words, right? In an electronic, it becomes harder, but they certainly can see the changes if somebody goes and looks, and you have to pay a lot of money, to make that happen. And you have to have some reason to think that maybe you should go looking and pay that money. And you would have a reason in that case, right? She didn't drink. So
Yeah,
how did
yeah.
that happen?
But you don't know what people have read and not
No.
told you they read, so you don't even know to correct it. The other thing I found out is it was very difficult for me to get as the attorney for the person who is in a rehab facility, for me to get a copy of the electronic medical records. And in some cases, we had to go to a third-party custodian that kept the records, that the hospital or the rehab facility doesn't even have the records, which seems bizarre to me.
Well, and as I talk about the definition of electronic health record or an electronic medical record, it's not the same as a paper medical record. So it includes all of this other information about you and your finances and whatever else they decide to put in it. And under HIPAA, and I know you wanted to talk about HIPAA, and I want to talk about the HIPAA form, but under HIPAA, they don't have to give you the full medical record. And they can give you a summary, or they can give you a snapshot of, and they don't have to show you everything that's in it. And when you go into the portal, you don't see your whole electronic health record. You only get to see the part that they will share with you. And I do discourage portal use. I don't use a portal at all because it is a lazy, well, it's a data gathering tool, but it's also a lazy way for them to say, oh, just go, find your own stuff, come on in. They don't have to provide you with anything. And this is just like wrong too. And I speak as somebody who's a nurse who knows that you shouldn't be telling people to go to the portal to figure out what happened in the visit or what your discharge instructions are. You should have somebody who goes over those discharge instructions with you. Make sure that you understand them. Ask if you have any questions. Make sure that you leave knowing exactly what to do and why. And so many clinics today don't have discharge instructions. They'll just say, go to the portal and you can find out, the summary of your visit, including the discharge instructions. And that's like bad medicine. But you were talking about, the data that you can get access to, and you just can't get your whole record because the federal law says you don't have to. They don't have to give you your whole record. They have to have an accounting of disclosures only for a certain number of disclosures. Certain things they don't even have to have an accounting of disclosures for. And it's a vast array of things that they don't have to even tell you or keep a list of that they shared the information there. So the electronic health record was built and imposed not for purposes of caring for you, not to make it so that you didn't have to provide all the information, and not to have, connect all your medical records, except for them. They want to connect all of your medical records. They want to gather all the data that you have. They want to use it to profile you and profile your doctor and control what your doctor can and cannot do. It wasn't built for you, and now it has made your life insecure, and it's a national security risk. If China wants to get into the president's medical records or a senator's medical records, it's much easier to try now because it's electronic and digital than it would be to ever try to get a paper medical record.
Okay, tell us about HIPAA. You were going to tell us about HIPAA.
Oh, I was just going to say that HIPAA is, so everybody thinks it's a privacy rule. It's not. It is a permissive data sharing rule. My book talks about all the players and everybody who wanted to access our data, and they knew that if they took away our right to privacy, which is what HIPAA did, and if they forced us into digital records, made everything computerized, access would become very easy. And so HIPAA has allowed the creation of state health information networks where everybody in the state can share your data without your consent because of HIPAA. And the eHealth Exchange, which is a national portal, essentially, where all of the participants of the eHealth Exchange, this national medical record system, they open their portals in their hospital and their clinic so that if a doctor in Washington State wants to see your medical record from Florida, they just go through the eHealth Exchange, if they're both members, the eHealth Exchange, and they can find all your data from Florida. And here you thought that because you were on vacation, this was going to be a private visit, and your doctor would never be able to see that record. But if they're part of the eHealth Exchange, they can, and they can because of HIPAA. Now, the only way to get protection from HIPAA is either to go to a doctor who you can pay cash to, or doesn't use an electronic health record, or that you get your state legislators to write a state medical privacy law. Most state legislators think you're protected by HIPAA. They have bought the lie that HIPAA is a privacy rule or privacy law. They bought it. They believe it. Even members of Congress believe it. They don't understand what it really is this huge, massive data sharing permission slip. And but if your state passes a strong medical privacy law, a state law, that state law supersedes HIPAA. That stops HIPAA in its tracks. But you have to convince your state legislators that you actually don't have privacy, and neither do they, because of HIPAA. And they should want to actually protect themselves from everyone who can have access to it. Now, when you go to the exam room or to the hospital, you'll be asked to either sign a HIPAA form or an acknowledgement statement that you have read, understood, or received the clinic's or the hospital's notice of privacy practices. It's called the acknowledgement statement. By law, you do not have to sign that, but that thing is meant to convince you that you have privacy. It's like just part of the deception scheme. Every time you sign it, when we went to Congress and we visited 22 offices, and I asked this question, or my associate asked this question. So when you sign that HIPAA form at the clinic, what does it mean? And to a person, almost using the exact same words, they said it means that my information is between me and my doctor. And this is the health policy staffers of members of Congress. So everybody has bought the lie. And unless you have a state privacy law, you will not be protected from HIPAA, but you can at least exercise your right not to sign the form that is meant to propagate the deception. So we have this refuse to sign the HIPAA acknowledgement statement form. And thank you, Lou, for putting that up there. And you'll see that you have a prominent picture of a phone there. And this form contains 5 different ways that you will be asked to sign this acknowledgement statement and how to get out of each of those 5 ways. And at the very bottom, it says how to refuse with no pushback. And this is the way that you should be prepared for all those different ways that they'll ask. And then if you can go up to them. This is what I do. I put the HHS website on my phone. And I refuse to sign. I fill out everything else that I'm going to fill out, refuse whatever I'm going to refuse. And then I take my phone up with me with the papers, and I have on the HHS website with the notice of privacy practices. And I point out, I said, this is why I'm not signing HIPAA. You see here, first bullet point, by law, you are not required to sign the acknowledgement statement. And then I point the 4th bullet point, which says, if you refuse, they have to write that you have refused and record that. So you do not have to click a button. You do not have to lift a pen. You do not have to write the word refuse. You don't have to do any of that. So this is on our website in our helpful handouts towards the bottom of it. And I would encourage you, all the viewers, to take this, get a copy of this, take it with you, put that website on your phone. I have had 0 pushback ever since I started showing that, because I just showed them at the top and I say, see, HHS website right here. I'm just going to scroll right down here, right here. First bullet point, 4th bullet point. And they're like, okay. And so I have one every time.
What's the reaction like? Because people are afraid to cause trouble. And
They
so
are.
they don't want to be shouted at or humiliated in public. So have you had any of that?
Only one time was I refused before I figured out that this is the way to do the pushback. Although I'm not sure that this clinic manager would have cared, because this clinic manager who took me into a separate room and told me why this is their policy. And I said, yeah, but by law, I have a right not to sign the form. She goes, I don't care what the law is. This is our policy. And then I said, well, give me my money back. And so we went back and got my money, and I've never been back. And I'm not going to say who that is, but you know, they have been scared by their attorneys into forcing you to sign because they believe that they will be hit with a HIPAA violation, and they will have to pay hundreds of thousands of dollars for violating HIPAA. But the fact of the matter is, the attorneys have not told them the truth. And so this is another way of just educating them that you have a right not to do this. It's also a way to protect yourself when they say something confidential that you just thought was going to stay in that room. You made sure that there was no AI devices in there. You know, you told the doctor, this is confidential between you and I. Maybe you even told the scribe to leave, right? But whatever, you thought it was confidential. And then you go to another office, and this office says, oh, I see you've got this medication for this problem. And you're like, what? I'm here for my physical therapy. How do you know this? And then they will say, well, you signed the form and it said you knew. And so if you knew that we were able to share it in all these ways, because the form says all the ways that they can share it without your consent. So now you knew that we could share this. And so it's your fault you told us.
Oh,
Well,
Christ.
and the number I've seen figures about the number of institutions across the country that that could get your information. It's thousands. That they're exempt from the provisions of HIPAA because what is the term that they qualify for?
Are you talking the
Public
business
information.
associates or the?
Business associates.
Yeah, so the number in a 2010 HHS regulation for HIPAA, they mentioned 2.2 million entities, not people, entities that have lots of people in them that could get access to your medical records if those who hold your records chose to share them. That's the thing about HIPAA. Nobody has to share your medical records. It's not required, but you cannot stop them from sharing them when they decide to share them. So anybody who has your medical records can share it with this whole cast and crew of people. There's even 12 national priority purposes in HIPAA that include things like organ procurement organizations, so that there you are in the hospital with your loved one who you think is dying but might not be dying, and the hospital calls the organ procurement organization and they come knocking on the door, and you're like, did I give you permission to come and talk to me about my dying relative? Why do you think you can do this? Oh, HIPAA. Huh. So national priority purposes also include public health. So, you know, public health even putting out how many prescriptions of ivermectin were given out during COVID. So they had it. They had an entire chart. They knew exactly how many prescriptions all over the country were being given out. And this is one of the shares for public health under the national priority purposes allowed without consent under HIPAA.
Twyla, tell everyone how they can get your book, because it sounds like everybody needs this book.
Sure. Well, they can certainly go to our website, but, you know, you can go anywhere, Amazon, anywhere, but bigbrotherintheexamroom.com will give you a one-page overview of it, but you can find it anywhere where books are sold, bigbrotherintheexamroom.com. And they can contact our office, of course, and we could ship them one if, yeah.
And how people can contact you, the organization, and follow you on social media.
So we have a variety of social media. They can contact us by going to the website, cchfreedom.org, cchfreedom.org. They can go to, we have Facebook for our organization, and we also just announced we have a Substack. And so we just opened our Substack, launched it on Tuesday, talking about the 23 years that HIPAA has now taken away your privacy. And so they can find our Substack, which is called the Health Freedom Dispatch. Thank you for that, Lou. And then we also have Twitter or X, and we have Instagram, and we have TikTok. And so just look for
Wow.
Citizens Council for Health Freedom on all of those.
You're so fortunate to be on all of those. We're pretty much banned on every single one of those things, but there we are.
Well, TikTok keeps taking us off, and then we keep coming back on.
Well, Twyla, thank you for educating us. It's such an education. Again, I feel like all people that are homeschooling should be tuning into a lot of the shows that we have on CHGTV. I mean, this is perfect education. You're just not going to get at school, right?
Yes, and actually we are going to build a curriculum for homeschoolers on healthcare, so these children come out and know things that adults don't know today, and they know how to not move us towards socialized medicine, move us to freedom. But the other thing is we'd like to do seminars for groups of homeschoolers who are interested in learning about how to protect children, or the parents of homeschoolers, how to protect children these days from before birth to adulthood, in the exam room, in the hospital, and from the government.
You know what would also be great is if you had qualified, an hour's worth of education that doctors could get credit for toward their they're called CLE
Their
credits.
CEUs, CMEs,
Yeah,
whatever.
CME credits.
Yeah.
It would be really great, because I bet a lot of doctors don't know all of this.
That's a great idea. Thanks.
Twyla, we have a section, Mothers to Be, which we're just about to relaunch, everyone, because Bella's had a baby and stuff. And we'd love you to go on that and talk to them about.
Oh, that would be fantastic. Yes,
Okay,
that would
I'll
be
get that set
fantastic.
up. All right,
Okay,
well,
wonderful.
our
Thanks,
time no, absolutely. Thank you. Time is up. Carolyn and Twyla, it was fun. And I think Catherine will be back next week, maybe.
No, Meryl will be here next week. Isn't that the last week of the month? Maybe not. We'll be back if Meryl's not.
Okay. All right. Well, to your viewers, thank you so much for your support, and we'll see you next week or tomorrow. I'll see you tomorrow.
Thank you.
So can you tell us your name, please?
David Ivan.
David, and who are you?
Joseph Iman,
How old are you?
14.
14 years old. And you are?
Hannah Ivan, I'm 15 years
And
old.
you're 15. And who's this?
Isaac Ivan. He's 10.
He's 10. Okay, so this is a story that's called Force Vaccinated. So let's go back and explain to us exactly what happened.
Basically, me and my ex-wife, we went through a divorce, not to get into that, but we ended up in family court. And we both never vaccinated our children, had to sign religious exemption forms all through school. In Illinois, we moved to Tennessee in 2016. I built a house and bought, this and that. So we went to family court, and I was surprised, but the first words out of the judge's mouth, their attorney, Emily Wright, that's head of Children and Family Services for the tri-state area, she's family court in charge. She raised a Bible up and asked if I believed in this, and I go, yes ma'am, if it's the King James Bible I do. And I go, you believe every word, or you believe none of it? She goes, Your Honor, I want him deemed mentally ill.
Because you believe the Bible?
Yes. And then it went through a bunch of other stuff, and then it come to the vaccines. The judge and that Emily Wright attorney brought it up, and even my ex-wife, she just didn't want a family anymore, nothing to go into it, but she has not been seen or heard of in over 4 years. He said, which one of you parents are going to vaccinate these children today?
So can I just ask you a question? How old were they at this point, and had they had any vaccines
None.
prior? So
Never.
You were completely vaccinated?
Never. I've never had any. My dad was drafted in 1961 in the Army, and he didn't get any either. We've never vaccinated. We don't drink alcohol. I drink soda, but my 2 kids won't even drink soda.
So how old were you when this conversation was happening?
Isaac was 5, so
10, 11, 10.
11
yeah,
and 10.
10,
And you'd had no
11, 10.
vaccine. Did you have any of these issues that
No.
we're seeing now? So none of this happened before this court situation?
No.
None of your injuries? No.
Hannah had allergies to a couple peanuts, but she can't eat peanut butter and such. That's why they split hers in 2 days.
Okay, so let's go back to court. Unvaccinated children, healthy apart from a few allergies, none of what
And we
saying.
had the exemption forms. I was at work, so she always took them to the doctor, and she signed her signatures. Well, Judge Todd Burnett from Fentress County ripped those sheets up. He goes, this was his exact words, I don't care what the law says. It is my personal opinion that not vaccinating your children is child abuse. And if you don't vaccinate these children today, you're not leaving with them. And I'm going to call CPS and find a nice home in Memphis to put them in. And of course, not to be mean or anything, Memphis scared me. You know, it's a big city. You know, it's a dangerous city, you know, because we come from Illinois, like Chicago's a dangerous city, you know.
All right. So he said it's child abuse that you haven't vaccinated your
Yes.
children. What happened then?
Actually, me and my ex-wife, we still stuck together. We go, no, we're not doing it. And then he goes, well, then he threatened us with CPS. And then her attorney, Emily Wright, whispered to her, and then she goes, there was some back and forth. You could tell she didn't want to, and she goes, okay, fine then. And he goes, then Emily Wright goes, Your Honor, my client will vaccinate these children immediately. And he goes, full custody to my ex, and you will pay child support. So they went down. I guess I wasn't there, so I've heard from them. They got the vaccines.
So can you tell us what happened?
Well, ultimately, we were young at the time. Mom picked us up. We went over to the doctors and got the vaccines and everything. It was a few days later that I found out that I was in the hospital while I was at school.
Who was in the hospital?
Isaac. I got.
This Isaac.
Yeah.
Yeah.
I threw up in the middle of class, so I had to go, and my mom had to pick me up. So I sat in there till the leave at the very end of it. I didn't know till then about Isaac being in the ICU.
And how did you feel? How many vaccinations did you get? Do you remember?
17, just like Isaac.
But not 17 in one go.
Yeah,
Yeah.
right in this arm, right?
Yep.
17 vaccinations.
Yeah.
Everything from birth to that age group, they all three received.
They said they wanted to like catch us up on like all the vaccines we missed.
Yeah.
How did you feel after yours?
I didn't really want it. They were trying to get me to consent to it beforehand. They were like giving me that look like, you want to do this, right? I knew I was like not supposed to get vaccines, so I was like, I don't really know. And then I kind of just gave up, and they ended up giving me like 7 or 8 vaccines that day.
You just had 7 or 8 then?
Because of my allergies.
And did you have more later? Did they come back for you?
I believe we had a second appointment. I don't remember if we went or not because it was a long time ago, but we were supposed to get like 8 during then, at least.
And then a few days after that court date, I was supposed to go pick them up for my 2-hour supervised visitation at McDonald's, you know, and she just drops the kids off and says, here. I'm like, what happened? No, excuse me, that was after. Right before that, I get served by the sheriff's department a 6-month restraining order. I didn't get to see the kid. Well, because they were hoping the 12 days he spent in the ICU with a 106-degree fever that did this to him, they were hoping that in 6 months they were healed and whatever happened was gone and over with.
So Isaac did not have any of these issues
nothing.
before? None of them. Do you remember him before?
Yeah, he was younger. He
was
just
like
grew
4,
up never being
yeah.
able to talk now.
So, and this just has injured him like this from those catch-up shots that you were forced to get.
Yep.
And I mean, that's just the beginning of it. After that, you know, she got, I'm not trying to badmouth her, but how I ended up with them, that 6 months, she was evicted from her apartment for the housing project. And she's like, here's the kids, take them. Hannah and Joseph will explain to you what happened. They were in Cookeville Regional Hospital in Tennessee. I cannot get the medical records. Judge Todd Burnett has sealed them and he will not allow them to be released. So I have really 100% no idea to the facts of what's happened, just from what they tell me. And
So you don't even know really, you can't get their medical records?
no,
You
the
have no
judge
idea
has
what
sealed them. And you know, we've been this last 4 years, I can't work. He has ABA, which is a great place in Crossville. It's momentum behavioral analysis. He's got a dyno box. He's learning to use the thing. He hits buttons to communicate a little bit. And then on Fridays, he has PT, OT, and speech and all these appointments are an hour each way or more.
And you haven't had any vaccinations since?
No.
No, so no one
And
can come
I'm in violation of a court order by Todd Burnett that I could go to jail for, but he said you're in violation, but I'm not going to enforce it. There's force vaccinated order in our file for them. That includes the COVID and all that other stuff that I refuse. She still has full custody and I still pay her child support.
But you don't know where she is?
Nobody knows. She has, Bernadette found her online. She's actually running an anti-vaccine group.
All right, well, let's not talk about her because she's not here, okay? This is an extraordinary interview. It's super sad. Now, you said something happened, was it this morning? With the...
It's on the phone, but I don't know the specific date. What was it, December 5th? We signed up and we started advertising, you know, the flyers, and then Bernadette, you know,
Advertising what?
This.
The bus.
The four visits, and you know, people from church. You know, we live in a small community. Word got around. They sent the attorney Emily Wright, her husband Evan Wright, which is the school board attorney for 3 counties surrounding us, and Judge Todd Burnett called the TBI and had them come to our house and threaten us not to come here.
Today? Because they don't want you telling the story?
Yes.
And you're still here?
Well, yeah, I mean, it's not just us. I mean, this could happen to anybody. And we may be Christians, but it don't matter what religion you are. You shouldn't be forced to do anything, you know, like that. And I mean, like I said, it don't matter what it's America. You have the right to believe what you want. And I mean, these kids are healthy. I mean, they don't even drink soda. We eat organic. I make all his he eats about 15 to 20 bottles a day. I got to make his baby food from scratch, change them 15, 20. I mean, I'm not trying to complain. They're a blessing, but it's destroyed our lives. I mean, Hannah and Joseph have made more bottles and changed more diapers than most parents. You know, it's a team effort. We can't do this by ourselves. And I mean, you said about the threatening, I'm worried that they're going to say I exploited these children or something, even coming here today. I can see a court date in my future just from being here, to be honest.
Do you want your dad to be telling this story to the world, what happened to you?
Yes.
You give him consent to talk about this?
Yes.
Yeah.
Okay, so I think we've got that covered. What is going through your mind? You said that there was police that came or something. Talk to me about that.
All right. So back in like December, it was a Tuesday. The TBI showed up at our house. 4 cars. I saw it through Hannah's window, so I couldn't tell much. Showed up at our house and just surrounded the place and started knocking on the door for at least 2 hours while we had to sit in our rooms. And from what I heard from Dad, they were armed.
So it was very frightening.
Yeah, we hid in the house.
Very frightening for you.
Two of them came up and knocked on the door, and I thought they were like someone with the mail or something. And then I heard like my dad call, I think Bernadette, and like said they would give us the police out here. So me and my Joseph went into the room, because I think we were sick or something. We couldn't go to school that day.
So it's very frightening for you.
And then we didn't answer, and then they went to the sheriffs and had them come out a second time, and I talked to them. I said, this is intimidation of witness. Leave us alone. If you have a warrant, arrest me. I'm happy to go with you. Bernadette had my bail money. You know, but a lot of things, and sorry to bring this up, Joseph, but we need to. Joseph was born with blind in one eye.
Okay.
So it didn't cause the vaccines, but it's just another thing on top. That's a hard enough problem to live with. I've had 4 eye surgeries myself. And through all of this, my health is like deteriorated. I'm fighting disability now, and I don't even know what to do about it.
Do you think the vaccines have affected you too as well as your brother? Do you have issues, gut issues and all those kind of
Not
things?
anything like that, but when it first happened, my arm swelled up like a baseball.
Your arm did?
And
Yeah,
he still
because
has
of
a
the
scar,
vaccines.
don't you?
Yeah, I do.
But I mean, our lives have been forever changed. Hannah and Joseph's future, her college, she wants to go to Belmont and become a lawyer and play basketball. We have to figure she's going to be taking care, and Joseph's going to be taking care of Isaac for the rest of their lives. And we haven't had anybody that has reached out to us or helped us at all until we found Bernadette.
God bless
I
you.
mean, I don't know what to do without her.
Okay. Tough, I'm so sorry.
But without his VeggieTale cartoons, Isaac just screams and whines nonstop, shakes, he will bite himself. Our lives surround him 24 hours a day. I get about 4 hours of sleep. I've only had about 4 hours of sleep for the last 4 years. I have to stay up every 2 hours and change him, and make sure he's all right. Diaper rash is horrible. He's got to eat, he needs 24-hour care and supervision. We used to have a nurse when it first happened, but 10-care legislative law, I went all the way to the top. It's a legislative law that can be changed by the legislator. 10-care has a statute saying you can have no home health care nurse for a disabled child if you have any other children in the home. So they took away our nursing care, so I can't even work hardly. 2 days a week. Luckily, I built my own house. I got a cheap mortgage, a VA mortgage. I did things right back then, so it's paying off now, type of thing. But it's a struggle. It's hard. Without Children's Health Defense and Bernadette, this is the first Christmas we've had that there's been presents under the tree. Basically it's day to day to day. It used to be.
This is just a tragic situation. I'm so sorry. Is there anything that you would like to say, maybe last words?
Mainly about how this shouldn't happen to any other family. It doesn't matter what you believe in or who you are or what race. This kind of thing should not be allowed to happen to any other family.
Yeah, basically what they said. This shouldn't have happened.
Yeah, I'm so sorry for you. Really, truly. And your brother.
My town is supposed to be some big Christian town. Everybody goes to church. Everybody believes in Jesus, but a lot of them don't act that way. I don't know how this judge could have made me deny Jesus on the stand, and I wouldn't. And, I just don't get it. He's perfect, but he can't talk. He has no life. And now we don't have no life. But I just thank everybody, and please spread the word. This could be your son.
Thank you so much.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.